I wanted to do is to look at the healthcare delivery system itself. Focusing, and after I went and said we weren't going to just, you have to think about the basic things we want. I'm still going to focus most of this talk on the healthcare delivery system, because that's where most of the reform that we're dealing with is taking place, because that's where the dollars are, a lot of the dollars. So what I wanted to, I kind of broke things down. And I can tell you, let me let you know also, this summer I've been working with an organization called Doctors for America. And that is a group that morphed out of Doctors for Obama. And basically it's about 14,000 doctors nationwide. And we all work together mostly with email in groups. And we have plans and actions that we all do. And we help each other out, support each other, and show pictures of what's going on across the country. And they have direct connection to the White House. So this is very much a grassroots activist doctors organization, which we don't really have otherwise. I mean, yes, the AMA has weighed in, and they've done a pretty good job. And I mean, numerous other physician societies have also weighed in, but they're all lobbyists. And this is, the Doctors for America is really, as I said, it's grassroots. But anyway, so as I've been working with them, I've been thinking about this whole thing. And what we have here is, when we talk about where we need to change things, and a lot of people will say, single payer is the answer. We need single payer. You hear that all the time, especially among Democrats. And I'm all for single payer. I've worked with Physicians for a National Health Program for a long time. But I just want to point out where that fits in, and that that's not the only answer, and it's not dealing with the only area that has a problem. That healthcare reform has to be a lot broader than that. So we have basically the funding sources, the places, and what is it? The patients, the employers, just the citizens are paying in to the funding sources here. Hi, Max.
Hi, Lisa.
And the money that they give basically is funneling through the providers. So it's the physicians mostly I'm talking about. And then they're the ones who are making the decisions about the services. So we have the collection of the dollars in here, and it mostly channels through the doctors. Some of it is also going over here to the hospitals and clinics and that sort of thing as well. But still those are run because there are doctors there. And they're fed by the doctors who are giving them the patients. So this is an area of concern for cost. And the services are absolutely an area of concern for cost. So we have to think of all those three circles. When we look at the escalating costs that we've had, it's phenomenal. And that is, if you're looking at our gross national product, the percentage, and you may have seen these figures, but in 1950 it was 4%. Healthcare costs were 4% of our gross national product. Then in 1966, the year Medicare and Medicaid were enacted, 5.5%. 2005, 16%. This year, 17% of our GMP. That is $2.5 trillion per year is what we're spending now. I mean, everybody's upset about spending $1 trillion over 10 years on health care. But just remember the bottom line. We are now spending $2.5 trillion, and by 2015, which isn't any 10 years away, it'll be 20% of our GNP, $4 trillion a year. It's overwhelming. Okay.